products. So please.
Thank you. Good afternoon. Thank you for the nice invitation. Just a few slides to remember what's the region we are going to treat and what's about necklines and the décolleté area. They are not very easy areas. They are so not very suitable to be treated generally. We should try to improve the skin of this lady, and we can do this with the two kinds of treatments. The first one is mesotherapy, that in Italy we call redensification or revitalization. But the second one, that's more difficult but more satisfying treatment, is the filler treatment. And so we can join the two treatments to get better results. What's about the morphotypes? I suppose a classification, an Italian classification, that we can share regarding the age of the patient from 25, where is an absence of problems, to 60 or more than 60, where we can find platysmatic bands that we can treat with botuline, as we know, or with filler if we have the turkey neck on the horizontal neck. So we try to do a redensification. So we redensify the dermis in depth with Redensity 1. That's a product that we use for this. We increase the firmness of the skin, the tonicity, and the shining of the skin. And so we fight against the defects of the skin. Which is the technique and the treatment and the protocols. If we have a young skin, not very damaged, we use the Redensity 1. If we have a more serious problem where we need to fill and to restore as well, we can alternate Redensity 1 and RHA1. RHA1 is a filler, is a new filler, very soft filler we can use for fine lines or wherever we need a very smooth filler. And we inject it more deep in the deep dermis. And so we can get as well the revitalization or redensification together with the filler effect. If we use Redensity 1, we do micropapules. They disappear in a few days, in a couple of days. But if we use the RHA1, we use a deeper plane, a deeper layer, and we use the linear technique. In the same case, we use the Teo pen, the electronic device that is painless. We can manage the patient much better than with our hands. This is a couple of results. You see a medium classification neck before and after, and another patient immediately after the treatment with the RHA1. You see the disappearing of the lines. Further on, I have later on another treatment with the hands. This is the scheme of the treatment that I will perform in the afternoon, about 4 or 5, I suppose, I don't know exactly because there is a late. And I start from the interdigital lines and I go with the cannula. I will show you one hand by the needle and the other one with the cannula, and I start from the interdigital space and I insert the cannula and I go back and forward and I release RHA1 or RHA2 if the situation is more serious than the one that we see. Now we go and we can examine the patient. She has no serious problem. If I can have the camera, please, and give me the gloves. Okay. The patient we have is not.
Peut-on baisser la caméra en bas, s'il vous plaît?
Is not a patient that has serious problems. Just a couple of lines in the neck. So we can use RHA1 to fill and restore at the same time. I will use the medical device. The Teo pen is the name of the device. We can clean. Thank you. Okay. This is the décolleté and the neck. Thank you. This is one. The needle 30. Okay, I can show you the pen. The pen is a device, an electronic device. It's very easy to compone. Inside the cap, there is the syringe, so we can remove the needle, insert the syringe, and after use it. The pen has 3 speeds. The blue one, the violet one, and the green one. The green one is the slower speed, the blue one is the medium one, and the violet is the faster one. I suppose to use the blue one with the 30 gauge needle. Goods. We try to see the, move the neck. Mouvez, s'il vous plaît. Merci. No risk. I remember we have only superficial vessels, but they are not a problem. Vous avez douleur, madame? Vous avez douleur, quelque chose? No? A pic. Just a pic.
Peut-on zoomer sur l'aiguille, s'il vous plaît?
We have to be very superficial, but we have not to get over-correction. And after, we pinch as a message to get a better result of the filling with RHA1. It's very soft, so we can have a molding message without any problem. So, madam. Okay. If we are in a superficial layer, we don't find any blood. Okay. Now we do something on the décolleté. She has not a serious problem, but we can improve. I don't know if you... Okay. We go deeper. And the quantity is a little bit more than the neck, of course. We can cross the deposits.
You have 1 minute, Giuseppe, please.
And we can repeat the session in 15 days and have 3-4 sessions to get the better result. During the injection, if you want, you can move the speediness and get a more fast or a slower one with the green or violet. With the violet, we have the faster speediness. Okay, I think it's enough. Thank you. We can message the distributed product. Here it's easier. We have the bone under the skin, so we can push a lot. And we can have some post-treatment cream, no? Okay. Thank you very much.
You have it in the
Thank
next
you.
room. So
Thank
just
you.
a minute.